Hepatitis C is a liver disease caused by the hepatitis C virus, HCV. It was first identified in 1989. Hepatitis C is spread by direct contact with the blood of an infected person. It is not related to hepatitis A or hepatitis B. Hepatitis A is spread through eating or drinking contaminated food or water. Hepatitis B can be spread through blood contact with any body fluid of an infected person. About 3,200 to 5,000 individuals are newly infected with the hepatitis C virus each year. Approximately one-third of persons with chronic hepatitis do not know they are infected. Because they do not know, they cannot take steps to protect their health and prevent the spread of hepatitis C virus to others. Hepatitis C is spread from blood to blood contact. The most common means of transmission is through injection drug use, even if the drug use was many years ago or if it happened only once. Sharing needles or any drug-related equipment is enough to spread hepatitis C. Another way of getting hepatitis C is through a blood transfusion from a donor who has hepatitis C, especially for those people who received a blood transfusion prior to 1990. The risk of getting HCV in this way is now extremely low because of the universal testing of all blood donors. Activities such as tattooing and body piercing, which may be performed without sterile precautions, sharing toothbrushes and razors, or any kind of blood-to-blood contact with an infected person can also spread the hepatitis C virus. The risk of getting HCV infection through ordinary household or workplace interactions is extremely low. The rate of transmission by sexual contact is considered to be very low. But people with multiple sexual partners should always practice safe sex. The risk of passing hepatitis C to your newborn is approximately 5%. Breastfeeding does not appear to transmit hepatitis C unless nipples are cracked or bleeding. Most people with hepatitis C have no symptoms and may feel quite healthy. Others may develop fatigue, jaundice, which is yellowing of the eyes and skin, abdominal and joint pain, nausea, and loss of appetite. Most people with hepatitis C are unaware that they have it and can carry it unknowingly for decades. Only a blood test can detect the hepatitis C virus infection. If you think you may have been exposed to HCV through high-risk behavior, a blood transfusion, or blood products, and you are concerned, you should see your physician. Approximately 15 to 25% of people infected with HCV have a mild, brief disease and get rid of the virus completely. Your family physician may refer you to a specialist to determine whether or not you require treatment. It is important for people living with hepatitis C to implement lifestyle changes. Maintain a healthy body weight, eat a well-balanced, nutritious diet, exercise regularly, avoid alcohol, avoid high-risk behaviors, get vaccinated against hepatitis A and hepatitis B. Most people with chronic hepatitis C feel well for many years. In 10 to 20% of patients, chronic hepatitis C leads to cirrhosis. In severe cases, hepatitis C may lead to liver cancer or liver failure. Hepatitis C is one of the most common reasons why people need to have liver transplants in Canada. The earlier you find out that you have hepatitis C, the more likely it is that treatment could be successful. If you have been diagnosed with hepatitis C, there is no need to become socially isolated, but there are common sense precautions you should take to avoid spreading the disease. Do not give blood. Do not share razors or toothbrushes. If you use drugs, do not share needles or other drug-related equipment. Inform health professionals who care for you and may be exposed to your blood that you have hepatitis C. Although sexual transmission is rare, inform your sexual partners that you have hepatitis C and take appropriate precautions. There is no vaccine for hepatitis C prevention. The Canadian Liver Foundation provides information and education programs for patients, families, and the general public through more than 30 volunteer chapters across the country. This video was produced by the Canadian Ethnocultural Council, a non-profit organization committed to promoting healthier ethnocultural communities. The content of this video was developed through a partnership with the Canadian Liver Foundation and funded by the Public Health Agency of Canada.